So I'm Dr. Midhun Malla. I'm an associate professor of medicine and section chief of gastrointestinal malignancies at the University of Alabama at Birmingham.
And I'm Shubham Pant. I'm a professor of GI Medical Oncology at MD Anderson Cancer Center in Houston, Texas.
And today we are debating on the most exciting, and everybody's looking forward to a debate on our KRAS inhibitors ready for standard of care in treating pancreatic ductal adenocarcinoma. And I am debating on the pro side.
And I'm debating on the con side.
All right, and the reasons I think why they are important, which think of is, pancreatic cancers is one of those cancers. Unfortunately, the median overall survival has been at 11.1 months since 2011, even now until 2026. And the rationale because of that is because, we do not have proper biomarkers that could impact potential precision medicine and biomarker targeted therapy. So I think, in my opinion, these therapies are prime to potentially, be applicable in the practice, especially with the data we have that's been shown in the early phase studies.
Yeah, Midhun, I think it's a great topic. It's an exciting topic. We have so many things happening in pancreatic cancer right now. I think, these drugs, the RAS inhibitor drugs, are potentially transformational for our patients in pancreatic cancer. However, since I'm on the con side, my thought is, yes, we have great data in clinical trials. I've had patients in my practice who have had, who've been on these clinical trials, and we've seen the efficacy of these agents. However, it's really not ready for standard of care, in my opinion, because we do not have an approval, especially for the majority of the RAS, at least in pancreatic cancer. We have some kind of data on KRAS G12C inhibitors, part of the NCCN guidelines, but no approvals as yet. So till you show me that data, I'm not convinced.
Yeah, I think that's a great problem to have at this point. We are talking about this really instrumental KRAS, and which has been thought to be undruggable for a while. And we do have, as Shubham mentioned, KRAS G12C, although it's a small subset, and Shubham likes to call a needle in the haystack. There are targeted therapies which are approved, and they're currently in NCCN guidelines. And talking about this new RAS on and RAS on off inhibitors, if you look at this efficacy, in the second line setting, their median overall survival now is almost reaching 15 to 16 months. I mean, it's not imaginable, I think, at least a year or two ago. So that's really the impact it is having. And even like targeted therapies targeting KRAS G12D, these do not have any impact on side effects. Like grade 3, grade 4 side effects are like 1% or less, and showing tremendous responses, which make significant which can make significant impact. In my clinic, my patients are really waiting for these treatment options, especially if they're progressing on frontline and second line.
I agree with some parts of what you said. Again, Midhun, the main part is that you're right. We are doing these clinical trials, which are ongoing right now. However, the data you mentioned is, again, very exciting, encouraging. However, it's a single arm, second line in a phase 1 trial. So obviously we have to take that with a grain of salt. We are waiting for the RASolute 302 data, which is the randomized trial. And we're all very hopeful in the pancreatic cancer community for our patient that trial is positive. However, we don't have the trial results right now. So if you really are a Puritan, and if you're looking at the data, then I don't know how you can say that it's ready for standard of care. But, I'm happy to debate you on this. You're a friend, great colleague, but that's the fun of these debates, OL and great debates, that we can sit down, we can have friendly banter back and forth, we can have a friendly chit chat.
Absolutely.
And we can hopefully, shake our hands at the end of it and kind of agree to disagree.
Right, indeed. And Shubham is a leader, and it's an honor for me to debate on this topic, really.
You're probably going to get me on this one. You're softening the blow. You're like, yes, this guy's great. However, once I get in the ring, there are no friends, right?
Speaking about RASolute 302, he's in fact one of the key authors of that paper. So it's going to be interesting to see how our debate goes. But at the end of the day, I think we're all here to help our patients, take it to the next level. I mean, it's really something that I haven't imagined that I'm going to be talking about. Like, we're going to be here, talking about this debate. And I just wanted to see what your thoughts are.
And I completely agree with that, Midhun. This is where we agree on. I think these new generation of agents are transformational potentially for our patients. And we really hope as a field, and for folks who've done pancreatic cancer for a long time, and really it's been a desert, to really see these little oases in deserts coming out, and really being transformational potentially for our patients is it's very heartening. So I'm really excited about the steps forward.
Absolutely.
Who do you think is going to win?
I think Midhun's going to win because he's already primed it up. You know what I'm saying?
That's so kind of him. And I also
Midhun's going to be like Dr. Pant's grip. I'm coming back.
to his defense, I think he's been the pioneer of the KRAS inhibitors, and it is hard if you're a pioneer until the debate starts, and then you just have to switch it off.
I know.
And you have to talk against it. I think it is.
That's why all I'm doing is making fun of Kathy.
Well,
So that's all I'm doing. So that's my whole slide set. So Kathy, beware. I'm just kidding. We hope to see you in September for the next edition of the Great Debates in New York.